Have you ever seen a child presenting with the tablet of poor feeding? Or if he is in preschool, he might has reported fever, painful ear, or sometimes headache that lasts for less than 3 weeks. What came up in the mind right away? Ear condition. But what is that? Acute otitis media. If you ask yourself what is acute otitis media, signs and symptoms, management, and more questions, your answers in this video. Let's get it started. It's the Zero M Health. Kindly subscribe on our channel for more important videos are coming. Acute otitis media is inflammation of the middle ear that lasts for less than 3 weeks. It is resulting from ascending microorganisms or pathogens that are responsible for upper respiratory tract infection. Most of the time, viruses are the first to be responsible, and that will be followed by bacterial superinfection. Most common bacterial pathogens are Leishmania pneumonia, Amphoras influenza, and Moraxella catarrhalis, while most common viruses are respiratory syncytial virus and influenza virus. Acute otitis media is a recurrent infection that predominates mostly in children younger than 5 years. Its peak age is between 6 to 18 months. The following are a predisposing factor for developing acute otitis media: age below 5 years old, premature and birth weight, family history, low socioeconomic status, tobacco exposure, attending daycare center, as well as in the winter season. What is the pathophysiology? The pathophysiology of acute otitis media is linked to a certain infection from upper respiratory tract, which pass through a station tube, and most of the time they are viral. The subsequent formation will lead to exudate formation, and then bacterial superinfection will occur. Clinical presentation of acute otitis media include fever, lethargia, hearing loss, headache, or chest symptoms such as anorexia, nausea, vomiting, and diarrhea. You should know that children with acute otitis media present on irritability and poor feeding. Diagnosis of acute otitis media is by otoscopy, which is a standard technique, where you need to visualize the tympanic membrane, and you should appreciate the presence of bulging, decreased motility right tympanic membrane. Tympanometry and acoustic reflectometry can be used to diagnose acute otitis media. Its management. Most cases of acute otitis media improve spontaneously. When treatment of acute otitis media is needed, it should be managed with analgesics such as paracetamol or brufen, with antibiotics such as amoxicillin. Notably, the use of nasal ear drops don't help in acute otitis media. If there is no improvement, then refer the case to ENT specialist. If acute otitis media left untreated, it can lead to different complications, which are classified into intratemporal or intracranial. Intracranial complications include meningitis, extradural abscesses, subdural empyema, brain abscesses, lateral sinus thrombosis, otitis hydrocephalus, coronary artery thrombosis, as well as cavernous sinus thrombosis. Intratemporal complications include hearing loss, tympanic membrane perforation, chronic respiratory otitis media, cholecystiatoma, tympanosclerosis, mastoiditis, petrositis, labyrinthitis, and fascioparalysis. Thanks for following.